Welcome to the nation. I'm NADIAH Abdul. Malaysia has made significant strides in mental health advocacy and ethical content regulation. Now, earlier this month, the Communications and Multimedia Content Forum of Malaysia, or the MCMCF, launched the Guidelines for Reporting and Sharing of Suicide-Related Content, which is an industry-led national framework that sets standards on how suicide-related content should be reported and shared across all platforms. Speaking more on this today, we have the lovely MEDIHA Mahmood, CEO of MCMCF, to discuss the matter. Thank you for joining me.
Thank you for having me.
And a very important month indeed. We just had a conversation on refugees, on crisis, and yet here we are today talking on suicide.
That's right.
Now, we know that suicide actually is the second leading cause of death of youths, at least globally, and we know that an estimated more than 700,000 people die by suicide worldwide each year. And while this effort really is laudable and it's much needed, we were just talking about it earlier, what actually sparked to this? What was the precursor that led to these guidelines?
Okay. So some people ask us, why are we having these guidelines now? But I think the actual question is, what took us so long? Because the issue of suicide and the way it's been reported and shared has been an issue for the longest time. And I think if we go back to during the pandemic, where people were getting anxious, there was depression, and suicide cases were at its all-time high, we saw it wasn't just news reporting that was talking about it, we saw social media having conversations about it in a harmful way. And not many people know that the way we share content about suicide can actually lead to suicide contagion, or what they call the Werther effect. So a lot of times when we talk to journalists and editors, they want to do good, they want to do right by the issue, but they needed guidance on how to do it. So we felt that this was the best time for us, not just to address media, but also to address content creators, social media users, so that we can continue to talk about suicide, but in a safer way.
I love the fact that you jumped the gun, because that was exactly what I was going to ask you. Why did it take until 2025? So while the pandemic saw sort of an increase in people perhaps being in a crisis that led to many different forms of self-harm, do we see that perhaps now this gap is being pushed by the proliferation of the way in which information is being shared?
Absolutely.
So who is this guideline going to be speaking to?
Okay, so our guidelines are supposed to be speaking to anyone who's existing in the content ecosystem.
Okay.
From news readers to journalists to editors to just one of us who's using social media. I have to highlight though that suicide guidelines, or guidelines for suicide reporting, was produced by MOH, Ministry of Health, in 2011. But when it was the pandemic and we were looking at it as a bigger issue, you're absolutely right. The way it was being shared and the platforms it was being shared on, the way the discussions were, it necessitated us having a guideline which was a little bit more holistic than just focusing on media.
I think, speaking from the experience of the work that we've done on the ground, one of the things that we've seen is not only the challenges that the youths are facing, but also adults, is that now there is an element of also broadcasting that situation of self-harm, right? In the child protection space, there are many different things and many different games and sinister type of clicks that tell you, okay, there is a challenge, and the highest level of challenge is committing suicide, and what are some of the things that you have to do. And the aim is to really broadcast this, right? You're supposed to go live in that process. So now, when we're talking about a guideline that emphasizes on avoiding sensationalism, which is a very thing that a lot of individuals are unfortunately forced to do or coerced to do now. But when we talk about media, how do we reconcile between that newsroom pressure to drive engagement, views and clicks, because the reach is meant to be there, especially in a 24-hour media cycle. So isn't the guidelines kind of going against what the media is meant to be fighting for, and the business model, in fact?
Right. I completely understand where you're coming from. I mean, I came from a broadcast background as well, and it's a lot harder now because you have citizen journalists out there, people who are reporting things when they're not reporters. They've never gone through the whole getting a certification on ethical journalism.
Correct.
But one thing that we need to look at is the fact that ethical reporting isn't the enemy of engagement. You do not have to look at sensitivity as something that would not get you virality. It's just I think the enemy to that is actually lack of creativity. So if we keep on relying on posting graphic, gory details and photographs, or having images and videos of people who are in mourning, crying about the loss of their family members or their loved ones, what's that saying about humanity? And we want to make sure that we're not asking the journalists to go down to the level of people without ethics. We want everyone else to follow the journalistic ethics of journalists.
So you're talking about a rising tide that lifts all ships. Now,
That's right.
I love the fact that you said ethical reporting isn't the enemy of engagement. I'm going to quote you on that.
Okay.
So if we're going to be talking about this, give me a real-time example of how we can do this better. In fact, recently we saw a case which was reported, not necessarily in the best way, relating to suicide. So if we were to reverse engineer this, what would an ethical reporting scenario look like?
Okay, so I think the basis for this is that a lot of people they believe that reporting means you have to put in all the details. And that's usually right, except for suicide. Because what we've learned, and this is global international best practices as well, that if you put too much details about suicide, it leads to what's called a weather effect, where suicide contagion happens. So method, location, pictures, even suicide notes, those aren't supposed to be published. And at the same time, things like the narratives of cause and effect. It's because they failed their exams, they did this, or because they had a fight with their husband, they did this. That is reducing suicide to just one factor when it's actually a multiple factor reason. So that's one of the things that we need to look at the very beginning. But more importantly, the overarching objective to talking about suicide in any way is to prevent further suicides from happening. So if we have that as our basis, then we know we need to put out helplines. For example, my discussion here with you, I should put out there that if anyone's listening or viewing this and they are in need of support, there's Talian Heal at 15555. So as simple as putting out helplines, talking about support, changing the narrative from something that glamorizes, dramatizes, or sensationalizes suicide is a way to help.
I love that. Now I'm going to ask you, when we're talking about there is this responsibility to put out helplines, one of the things that I've seen firsthand is that our helplines are not necessarily accessible to a lot of the people who may need either assistance in different languages or people with disabilities, and trying firsthand, working firsthand in some of these cases where there's self-harm involved. How can we do better? Does the content guideline in any way talk about ensuring that the lines that you're sharing are actually the lines that are going to be helpful for people? Otherwise, it's going to be giving them information and then nombor yang anda dial, and then it doesn't go anywhere.
That's a great question. So what we've done in the guidelines, if I can also show you, and this is something that we got from the public and reporters, when we talked about wanting to make the guidelines a little bit more accessible. So we've got QR codes, which leads you to helplines, which we tested out is effective. And it goes to a live document that's going to be updated constantly. We also have a list of experts and resources. So for example, if you're doing a news report on suicide and you need somebody from the medical fraternity to talk about it, or if you want somebody with lived experience to talk about it, this leads you to a list of people that you can contact who have already consented to being contacted to talk about this.
And this lines that you are having inside the guideline is actually free?
Absolutely. Well, yes, I believe so. Helplines they're all free.
Okay, I realize that some of our helplines are not free, so it'd be great if we have all our helplines to be free.
You need to tell me which one that is. I hope it's not here.
Okay, we're going to go through that. Okay. Now, when we're talking about the line of sponsorship and responsible reporting, you were just sharing that earlier, right? Who ultimately gets to decide what's ethical and what's not? Is it the media houses? Is it the government? Is it Content Forum? Is it bereaved family? Because what I might find to be insensitive might be totally okay for somebody else.
Right. So what we've done is when we developed this guidelines, we made sure that it's not a top-down approach. We're not the subject matter experts. So we sat down together with medical practitioners. We worked with the Ministry of Health. We worked with people with lived experience as well. And we worked with the media. We worked with journalists who have been reporting these stories because we wanted to make sure not only is this comprehensive and holistic, it's also practical as well. So the standards that are in here are standards which are universally best practice, but at the same time, we made sure that it's also applicable and more relevant to how it is here in Malaysia. But because there's a difference in that as well, we can't just cut and paste stuff and put in here.
What have you found in the process of creating this guideline that you thought, oh, that's interesting? I didn't think that this would be it for Malaysia, which would be different from, say, another country.
I think the main thing that's different in our guidelines that I don't think you'll find anywhere else is that we have a section specifically about talking about suicide in multi-faith communities.
Right.
Because there's one thing about all faiths, not just Islam, but all other religion, there are narratives which is a little bit harmful when we talk about suicide. For example, if somebody goes to you and says, I'm thinking about it, and then your comeback is that you shouldn't do it because then you'll go to hell, or you know, there are punishments.
The
out there.
religiosity
That's how-
of kind
yes,
of like,
exactly.
thou shalt not unalive yourself.
That's right.
Yes.
So I'm not debating that. I'm just saying that shouldn't the narrative be a little bit more helpful? Because all religion also talks about empathy and mercy. So that should be the discussion that we have. And places like mosque and temples and everywhere else, places of worship, have people who are willing to speak to you about it and giving you the support that you need. So that's that angle or the narrative that we are also putting into the guidelines.
I think you've put a very important point about the fact of how faith, or actually perhaps, you know, whichever your spiritual inclination would be, is a big anchor or not to whatever it is that you decide to do in crisis. Are you also working with, for example, Jabatan Agama or the, you know, the religious groups in trying to help them understand what the suicide guidelines is, and perhaps, you know, include that in a sermon or include that in a, you know, a khutbah or something like that?
Now you've jumped the gun.
Okay.
Because that's exactly what we do plan to do. Now that we've got the guidelines, we're reaching out to everyone who would be involved in this.
Wonderful.
And you're absolutely right. That's the best way to reach out to people of faith.
And we found that during the pandemic as well, right? I mean, when we were trying to get people to self-test and take the vaccination, in many communities, you know, if you have anti-vaxxers or you have people with very strong kind of inclination on what's right and what's wrong, they don't want to listen as easily. But if you get them to the people who deliver the message in the way that they listen, that's a, you know, that's a different thing altogether.
Precisely.
Okay, let's talk about the content itself, right?
Okay.
Your guidelines actually call for avoiding explicit description, and you mentioned that earlier.
Yes.
Things like exact location or even photos. But do you think that this might risk, you know, a situation of underreporting of suicide or masking it under like a health crisis that actually should call a spade, under the veil of dignity? So how do we strike this balance?
That's one thing. When we were doing this, there were a lot of feedback as well. They were saying this is a form of censorship, or this is basically trying to stifle conversations about suicide. That's absolutely not what we're trying to do. The issue of suicide should be talked about more. The issue of mental health should be talked about more. The only thing that we're trying to do here is to make sure that the narrative doesn't harm others. That's it. So these guidelines are supposed to help that. I think one of the other reasons that we put in here is that the content that we put in with regards to suicide, again, I have to repeat myself, always has to be thought on the lines of preventing further suicides.
Yes.
And I always say this to everyone, that this is your opportunity to actually save a life, because it is a public health crisis, but it is a way that we can talk about it safer.
And I think certainly there are ways in which to talk about something, a crisis really, in a positive manner or in a proactive manner.
That's
like,
right.
Call it out. There is a challenge here that we are seeing an increase.
That's right.
But I think that whole idea of prevention rather, or recovery, rehabilitation, reintegration, as opposed to demonizing the person who perhaps had tried but did not succeed, and then it's a situation of you are that weak person that did A, B, C, D, E.
That's right. I mean, that's basically the stigma and the stereotype that these people face. You're right.
And when we're talking about highlighting recovery and prevention, I think this isn't just about editorializing by default, right? We're not talking to journalists and people in the media to just focus stories or how to frame them, but how do we defend an individual or parties against claims of maybe compromising journalistic independence? You know, if we're talking about the situation that we're seeing right now, we want to talk about recovery and prevention, but how do we also ensure that whatever that needs to be said is said in a way that really needs to get to the ears of the people on the ground?
So that's the best thing that you could ask me, because that's also the feedback that we get from editors and journalists. Because they say, you know, we don't want to be told what to do, and I completely agree with that. I don't like to be told what to do, but this is a framework for them to refer to decide how best to do what they want to do, but in a safe way, in an ethical way.
Actually, if you think about it, even people who are thinking of self-harm don't like to be told what to do.
Exactly.
No one likes to be told what to do.
do.
So when we're talking about obtaining consent, and this to me is a minefield, because not only in issues of crisis, you know, it could be homicide, it could be murder, it could be, you know, theft. Obtaining consent in reporting, I find, is something that's lacking. We don't do very well. We assume that if I snap a picture from a meter away, that was my photo, you know. But when we're talking about consent to bereaved families, you know, this is ideal, right? In an ideal situation, we should be asking for consent, because it's not just about the person who's lost his or her life. This is about a whole family that has lost someone, or a community, or a school, whichever the case may be, right? But in breaking news scenarios, how realistic is this going to be when you've got this and it has happened maybe an hour ago, and this is going to go straight live on TV? You're not going to have that let's call and ask. Doesn't this risk opening up, you know, legal grey zones for editors, perhaps?
I think when it comes, we also have a chapter completely on interviewing bereaved families as well. If you're interviewing them, you've asked for an interview and they gave it to you, that's already consent. But on the other hand, what is also something that we've seen is when you do stories about suicide and you start trawling their social media pages for the photos and pictures, best thing to do is to ask pictures from the families. But I understand if you're in a hurry and the profile is public, you feel that you can take it, but there is discretion on what kind of photos you pick up as well. Sometimes you see situations where the news reports talk about suicide and they take the most controversial photos from the person's Facebook,
because that's
Instagram.
the one that's going to be clicked.
Exactly, which is, again, a method by which you have failed to see the person behind the story, and you have failed to see that you are affecting the people who are left behind. So I think that's just humanity that's missing.
Definitely, and common courtesy. I think that's a challenge that we've seen across many different cultures, especially in the situation that we're seeing right now. Now, when we're talking about youth suicide, and we're seeing a rise in this, right? We know that the MCMCF guidelines advise against memorializing or glorifying the deceased even on social media. But peer-led grief and loss is actually a very real thing, and we've seen this happening many rounds now, not even prior to the pandemic, right? And healing for the youth is a very digital culture. It's different from, for us, perhaps we'll just detach ourselves. How do we regulate empathy without silencing grief that needs to be expressed?
Right. Number one, there is no way we can regulate empathy. Empathy is either you feel it or you don't. It has to come naturally. And at the same time, you're absolutely right. When youth, peer-to-peer support is very important as well. And in the guidelines, we also talk about self-harm, which is quite predominant among the youth. We talk about how youth should also be referring to the guidelines, especially when you have lived experience. When you have perhaps thought about suicide and you may have almost went through it, but then your recovery story is what needs to be said. So what we want to do is to make sure that we don't stop youth from talking about these issues, that they just have to do it in a way that does not harm other people, that doesn't harm their peers. So the narrative should always be, we're not saying you all kumbaya, we have to be positive all the time. This is not that kind of topic. But the basis or the foundation for whatever discussions that we have online should always be back to giving support, and also helplines, and also narratives that says you're not alone, that there are ways for us to support you, or if not us, then other people out there who can support you. So that's,
I think the you are not alone part is extremely important. So are you, possibly engaging young adults or youths from schools, especially telling them about ethical online behaviors, what to share and what not to share? One of the things that I think would be great, because they now speak in emojis, and we saw adolescents on Netflix, right? But ways in which we can actually help perhaps identify and even possibly flag a situation before it happens, right? I would love to see more situations of an intent that was caught before the act, rather than reporting after the fact. And this definitely is something that if we tell people how to spot the signs of a person in crisis, we're able to help more. Then we're not going to be talking about how you report it once the person is already dead.
We're preventing it from happening.
Exactly. I had a really good time reading your guidelines.
I'd like to quote you on that.
All 40 pages of that. But I do know that when you were developing the guidelines, you also did a comparative analysis of global best practice. So we know that the Malaysian guidelines is not built in isolation. MEDIHA and team went through all the different countries that had us. So this was, a very comprehensive look. Now, with reference to global guidelines that we know in the UK, in Australia, in Canada, in New Zealand, in fact, there's so many countries. A lot of them tend to be in the global north. When I noticed that, we first started out this journey. Which country's approach do you feel made the most sense to where Malaysia was going to head its own, or was ours completely original?
Oh, I couldn't say
other
that.
than the WHO, other than the WHO guidelines, of course.
So we did scour the whole global community to look for this, and I have to give credit to our working group, which also consisted of psychiatrists and people who actually are working in this space, because they flooded us with materials. Which we had to review, and we were very happy to review. What did stand out to me was Australia. I think they had what was called Mindframe, and the UK also has
Mindframe Initiative.
That's right, and the Samaritans guidelines as well. So I felt those were very polished, very simple and practical ways to base our guidelines on. So those were, I think, our two main ones as well. Of course, we also look at MOH's previous guidelines on reporting, and we also had a lot of original things that I think was crafted within the working group, especially when it talked about reporting or sharing about self-harm. You rightfully pointed out that with social media, youths are doing self-harm sometimes for the sake of it.
Yes.
Sometimes for the trends. And how do we approach that kind of conversation? And at the same time, how do we talk about it without highlighting it to the youth who had no idea about it? We don't want to bring attention to it.
You don't want to give ideas.
Exactly.
Right?
You don't want to do that. So those are things that we are still trying to work through and see what's the best way to do it. And we definitely welcome other partners who may be subject matter experts on this to work with us.
I thought it was really fascinating to learn, which I didn't know before, that there were 10 to 15 countries that had formally codified their guidelines. Yep. And you know, you've got Australia Mindframe, the UK Samaritan's Media Guidelines, you have Canada for the guidelines via CBC and the Canadian Psychiatric Association, New Zealand through their Ministry of Health, United States with all sorts of different things.
Yes.
But there were also countries closer to ours that were also doing things, right? So there was India, Bangladesh, Bhutan, Sri Lanka, Taiwan. But the challenge here is, so the proof of the pudding is, unlike, for example, New Zealand, right, where we have broadcasters who can be fined for violation, we know that our guidelines are right now advisory, right? So are there plans? Because how does it work? Without penalties, are we going to have a situation where we're going to have a guideline without the teeth necessary, taring yang diperlukan?
Yes, I understand. Yeah, so the nature of the content forum of CMCF is actually, you know, we're an industry forum and these are voluntary guidelines. But the ones who are our members, the broadcasters who are members, the media partners who are our members, have developed this with us. And the whole system is, you've built this with us, you believe that this is true. If you do something that breaches these guidelines, the Complaints Bureau at the Content Forum actually has the opportunity to check your work and see whether you've breached it. And if you've breached it, usually if it's a first-time offense, stuff like that, we don't normally go towards punitive, but we do have the option to offer a compound of up to 50,000. But the very nature of our work is that we don't believe necessarily that regulation or compliance needs to come with handcuffs and punishments, because if you measure the success of a guidelines on enforcement and how many cases we've compounded,
second, carrot and stick method,
yes, that one is probably not where we are. Because we measure it by how it changes the mindset, how we build it into the muscle memory of everyone in the content ecosystem, so it just comes naturally to you. And we've seen how this is working because we've got editors who themselves edit the headlines. We've got journalists who ask for briefings. We have influencers who also call and say, I want to share about this, this is okay. Wonderful. So this is the consciousness coming alive, and I think this is a lot more long-term and hopefully less punitive, or we don't have to rely on that too much.
I love this conversation. Unfortunately, they say masa mencemburui kita. I've got this one question, but I'm going to mash it into two because I want to see, you know, I really like to have your thoughts on this. So you said, you know, when we're talking about streaming things live, when we're talking about the blurring lines between fact and fiction, let's face it, these days we have a lot of content that's out there that was perhaps a movie based on real events, right? So in actuality, the rules don't. How does the rule include things like entertainment content, film, or even live streaming of things? You know, if you can say menurut kisah benar, whichever the situation may be. But what are some of the ways in which we can engage some of these stakeholders or even platform owners to be able to have this conversation on what's ethical and what's not? Where do we blur the lines between this is fiction and this is actually giving ideas to people who should not?
Exactly. So fiction or not, when we talk about suicide, it applies to all. So in the guidelines as well, we do have a chapter on filmmaking or drama or documentaries. And what we need to see is that sometimes this has a little bit more impact on some people who don't watch the news, but they binge a whole series or watch 50 reels on the subject.
Lots of people are doing that now.
Yes. So we want to make sure that whatever content that's put out there still follows the guidelines. We've got film associations who are our members, and they also have already asked for there to be training. And I think this is a conversation that we can continue to have so that the spread is a lot wider and it can reach a lot more people. Live streaming, the only thing that I can say out there is that we need to call out people when if they see someone in distress, the first thing they do is pick up the phone, not to call the police, but to call for, you know, to live stream or record. That is a habit that we need to really get rid of.
Thank you so much, MEDIHA, for your thoughts and your insights. Of course, the important work that the MCMCF is doing, not only in promoting responsible practices, but like you said, changing that mindset. Now, as Malaysia moves forward in creating a more ethical and compassionate digital space, these guidelines are timely and much needed to care for all. Now, before we close, MEDIHA, tell me that helpline again. What's the number?
Talian Hill 1555.
Talian Hill 1555. Malaysia, stay safe and be kind.
sumpah demi Malaysia, Malaysia, Malaysia. Ku genggam jiwa dalam gemilang kibar semula. Sumpahku akan setia kepada negara. Rukun dalaman jiwaku, bebaskan akal mindamu. Perjuangkan keranamu, lebarkan gelombang aku. Yeah, benderamu, perpaduan jalannya untuk teguh. Sampai masa kita semua kata tak maju. Ku bertaruhkan nyawaku, I'm going through the pain. Sampai mati pun aku takkan mengalah demi yang